Okay, we are back. We're back, we're back, we're back. We're back, we're back again. We're back, we're back, we're back, we're back, we're back, we're back again. Yes, we are back, and it's still Dance Boss with Kathy. Today, we are talking about the state of dancers' health. Dancers' health and the creative industry. So not just dancers, everybody that works with dancers, from hairstylists, tailors, producers, MCs, vixens, graphics artists, cinematographers, everybody in the spectrum of the entertainment industry are under the creative industry. And we are saying dancers' lives matter as well. My focus is on the dancers and people that dancers are working with. Let me try and get Avon HMO. Hoping it works this time. Precious, yes. Yes, directors. Finally.
I don't know what's happening, Kathy. I really don't know what's happening.
Thank you, Lord.
To understand what could have possibly been going wrong all along, but I can't. I really can't understand it, because I've been sitting here and waiting for the thing to connect, and other people in my office had no problem, linking on. Anyway, we're glad to be here. Glad to finally be able to talk to you.
Thank you. I'm glad to have you here. It's an honor to have such a distinguished guest, especially from the corporate world, because in our world, it's not normal. It's not easy to get the ear of the corporate Nigeria to, with the way dancers have been treated over 2 decades now. It's been very difficult for us to be heard in the higher realm. And I thank God for the opportunity that I have as a brand to have such a conversation about the state of our industry with you, and the humility and honor you gave me to listen to what the problem is and say, Kathy, let's have this conversation. I told people before you came on board, I said, you have had a conversation with me, but I said, no, this is not a conversation I want to be by myself with. I need us to have this conversation with the young people that are, in the middle of all of this. And that's why we're here today. So thank you so much for honoring that. Yes, ma'am.
You're welcome. And I can see everybody that has logged in from all over the world. Gosh, that's so impressive. And I want to say I'm really happy to be here with you. And I'm really, really also privileged to be, somebody that is going to work with Kathy on just empowering, the whole creative industry. When she first came to speak to me about the ideas that she had, I was very moved. Many young people don't realize how fragile their bodies are. Many young people don't realize how fragile their health is. And for dancers and a lot of the creative people that are in the industry in which you exist, you make money, you make your livelihood with your body and your health.
Yeah.
Other people fall ill and they have sick leave. Other people fall ill, they call it to work, and money still gets paid at the end of the month. But you guys, anything is wrong with your body, there's no food on the table. Something goes wrong with your body, it affects your ability to earn a living and to earn an income and to look after yourselves and your family. So your body and your health is your greatest asset. That's your most valuable asset. So, I want to give credence to you guys for even coming around to a topic like this, because it's not very exciting things to talk about. When you're young and you're healthy and everything is going for you, you never think you're going to be ill. You never think anything bad is ever going to happen to you. So talking about the health is the last thing on your mind. It's for old people. It's for people who are sick, not for someone that feels healthy and vibrant. So for as many of you that have logged in, I want to just give kudos to you. It shows that you're strategic in the way you think about yourself. It shows that you are going to have, a viable, long, healthy life, and you'll continue to put on your table with the art that you perform and with the gifts that God has given you. And Kathy as well, I want to commend you. Before you, nobody really recognized dance as a profession. Dance was really something that people thought dropouts would do. Dance was something that people used to ease tension, go to parties, but I think many young people are now seeing dance as a way to propel themselves, to give the quality of life they want to have, so they can be proud proud of. That's going to take them all over the world, get them into the Guinness Book of Records, you know?
Yes,
So and the way you're passionate about it, and the way you're trying to put structures around it, the way you're empowering people who are coming into it to think about it as a means of ensuring a livelihood for themselves for the rest of their lives. One of the most inspiring stories I've ever read, I read when I was probably in my 20s, was about a dancer in her 90s, a professor of dance from Harlem. She was over 90 when I read an article about her. The shape she was in, even as a 20-something-year-old. And it was amazing to me that she was still practicing her profession. She was still teaching dance at 90 plus.
Hey,
Still performing.
That's me in the future. That's me.
90 plus, she was still in demand. She was still performing. She was like, you know.
Oh, I know her. I know her. She was still performing even in Las Vegas. They always wait for that point for her. The younger her does from the beginning. Then towards the end, she must come out, and people stand up for her. This standing ovation when this woman comes out. I remember.
As a dancer, have a career that lasts till your 90s. How many lawyers have careers that last till their 90s? How many doctors? How many bankers? How many engineers are working till their 90s? So that's why, you know, this conversation is so important, because part of what we're doing is arming and empowering the dancers and the other artists that you have in the creative industry to look at their bodies and their health in such a way that their profession continues to take care of them well into their old age. Because it's what we do in our health now that will tell us what kind of state we're going to be in our 50s and our 60s.
Exactly.
So very happy to be here. This is the context in which I'm here today, guys.
Oh my God. Oh my goodness. Let me check it off. Oh my goodness. This is like so inspiring for me right now. And you have no idea how I feel that, you know, we're having this conversation right now. Because I've been on this matter for a very, very long time, especially in the past 2 months. We've experienced, 2 months ago, we experienced like 4 deaths in the dance industry, painful ones. And when we looked into it, we found out that it could have been avoided if they got medical, you know, attention on time. You understand? And there are still many more that are dying slowly. I personally have a few of them right now that we are spending money on. And we are spending too much that we should be spending on to keep them alive, because they are going through ailment that they can't even tell their friends. Don't know what to do, because they are even
I found that very moving. I have to say, I won't mention names, but the story you told me about a dancer that you worked with in the past that, you know, contracted tuberculosis, had a really terrible cough. She didn't know how bad it was. You know, her family sort of threw her out. She had children she was fending for. It got really, really bad. She carried the tuberculosis for about 7 years by the time you got to know about it. That's just tragic. That's tragic.
7 years, oh, she has been with it for 7 years. By the time we did the test, man, everything, we now found out that it has gotten to a tumor now. It's not a tumor in her chest. It's not a tumor. So imagine how much does she have? And she has 2 children. Her husband has left her. Do you get what I'm saying? She has 2 children. We're still trying to help her. So the first thing we had to do was a diagnosis. She didn't even have money to do a proper diagnosis. You understand? The diagnosis check alone cost us a lot of money. You understand? That we had to do to let us even see the real state to fix it. So I asked the hospital, can it be fixed? They said it can be fixed, but it's going to cost you money. So I was like, okay, you know what? This plenty money. How do we even get to a point whereby a dancer can have an ailment and still afford medical care? And that's why I ran to you guys. I actually spoke to so many HMOs, not only Avon, but Avon gave me the passion, the drive. See, Avon, the reason why I'm talking to you guys is because you were not talking to me like dancers were products. You are not talking to us like we were numbers. That, okay, let's see how much we can sell with you people. You were talking with the passion of a mother, of a company that actually, I felt like Avon was a mother talking to me. That's how you, because, Simba, when you were speaking to me that day, I just felt like dancers finally found a mother that can care for them. Because you were talking, you know, and that's where you were talking. You were talking like, Kathy, See, the reason why we want to work with you and find a solution to this problem is because I have a passion to use my HMO to help the youth of this country. And you want to help the youth in the creative. So it's almost like it was like 1 + 1 is equals to 1 in this situation, because we are like, look, if the creative industry, if the population of Nigeria is youth, highly youth, okay, if we have about 70% youth in this country, Abi, then we now look at the percentage doing creativity in this country is also 70%. So if Kafi is working with the creative and everyone wants to meet the youth and help them, it's supposed to be something that, so you are talking not from selling products, you are talking about how do we get an average child on the street on a plan that is affordable and they can get any medical treatment that they desire. How?
Yeah.
You understand? And that conversation is the reason why we are here today, to say, what are the possible solutions, ma, from your own experience as a healthcare provider that we can have, and how can we have it in a affordable manner? Because we're not going to say it's free. Doctors need to be paid, nurses need to be paid, and all of that. But how can we do where a dancer that has an average income, you know, because dancers earn between 5 to 10,000 naira, and that's the lowest level, 5 to 10,000 naira per gig. And if they get 3, 4, 5, 6, 7 gigs a month, how can they still afford an HMO? What are the possible solutions we can get, ma'am?
Okay, so let me first even explain the whole concept of HMOs.
Okay.
And how health plan works. So the reason why, you know, it's good for someone to subscribe to a health plan is that on our own individually, if we tried to access health care services when we need it, it's expensive. So like you said now, that lady that had tuberculosis, what you described now gives the medical treatment she's going to require would be hundreds of thousands without even getting the details from you. At the very minimum, it's going to cost you like 600 to 700,000. Minimum.
Yes, ma'am. Yes, ma'am.
Who can afford that? You know, how many people can put their hands in the pocket and take that out? Let's not even go that far. You know, dancers have injuries from time to time. Maybe you break an ankle, you break your elbow, you break an arm. And sometimes, you know, these injuries are not also necessarily physical injuries.
Mental.
There's abuse, there's exposure to addiction, there's all kinds of other things that are also actually needing medical attention. You know? So, and there's the normal things that we're all exposed to. Malaria today, typhoid tomorrow, you got infected, sexually transmitted diseases. You know, there are all kinds of things. Appendicectomy, you know, you
yes, I have dancers that have had appendicectomy, or plenty.
You know, so there are all kinds of things. And at the end of the day, when these things occur, they don't give notice. They just come, bam. And if you don't have money, and many people don't have as much money as is required at that point, but
at that time,
at that time, if everybody has been contributing a little amount consistently over a period, there will be a pool of money created, so that when one person out of that pool of people need it, is that pool of money So the money in the basket that has been put together is actually what is used to take care of everybody. And it's enough. Because health plans are also designed for clusters of people in mind. So health plans for young people will be designed with young people in mind. We know that by God's grace, most young people don't have hypertension, most young people don't suffer from hardening of the arteries, most young people don't tend to have diabetes. There's some diseases that only come to you as you advance in age. So the health plan for younger people are already priced and designed to look after the kind of ailments that tend to happen to young people. And they tend to be less, so they tend to cost less. You know, so the idea is that it's to meet your need if they occur. Nobody prays for it. You know, a joke I often say is that I would rather pay the contribution and never use it.
Yes, I know that yeah,
I've been contributing and I'm not falling ill. I didn't need the operation. You are eating my money. No, HMOs don't eat your money. Other people who have been falling ill and needing services have been using that money.
Yeah.
And there is, let them continue to use it. I don't want to have to use it. it's actually a blessing for me to contribute and have other people fall sick and use it. And know that, God forbid, if I also fall sick, then I will have access to it. So that's why it works. That's why it works. And that's why it's the most equitable and most efficient way to access healthcare solutions, in any country,
And thank you so much.
Yeah, you were going to say something.
Yeah, I wanted to say something. My mommy, continue, ma.
I was going to say that the fact that HMOs also, and even that's something we pride ourselves on, is that we have a pool of medical staff who also act as a quality check on the hospitals. So when you subscribe to an HMO plan and something happens and then you go to the hospital, there are doctors and nurses who work with Avon HMO who are also following up on you, which you normally wouldn't get if you alone went to a hospital. It's whatever they tell you, whatever they treat you with, that you'd have to be satisfied with. So in this way, how we help to look after you. The support financial is also medical.
Okay, good. So to even make dancers understand this properly, it means that when you're under an HMO plan and you are making your premium contributions, it's just to prepare an avenue, peradventure something happens to you, where if your HMO plan is, say, a 30,000 plan for a year, you understand, and you are paying quarterly, you are paying 10,000 naira quarterly, it is very, very likely that you have an injury once that can even cost you 100,000, and the HMO takes care of it, even though you pay the 30,000 naira premium. So 30,000 naira is too little a money to drop yearly for in case, and in case that can cost 1 million naira, and in case that can cost 700,000, where you can't even afford it. So these plans actually help you to be prepared for that in case, but collect a little amount of money for that guarantee that you can get access to medical care. You understand? So I'm just saying, repeating what she said, guys, so that we can understand it very, very well, what it means. So we are responsible. One thing I need dancers to know is that we must stay away from thinking that things need to be done for us. We need to take action for things. We need to do things for ourselves. What we just need to beg the system for is, can we access it? Can we afford it? Can it be available? Because one other problem I've heard people complain about HMOs is the quality of the hospital chains that they have. What do you think is leading to that? What causes that? Is it based on which HMO company you are dealing with, or is it a general problem with HMOs? How do we find a balance in that area where the quality of the service is at stake?
Yeah, I think there are two ways to look at it. Is that, we're all in this country called Nigeria, and, HMOs can contract only with the hospitals that exist in their community. So we do know that as a country, we have a challenge of quality healthcare facilities. So it is the healthcare facilities in our country that HMOs contract with. So as a country, we need to do better. We need to raise the standard of care across all our facilities. That being said, however, going through an HMO actually makes it better because, like I said, we have medical professionals in HMOs, well, in Avon we do, who look at the quality of services that these hospitals are delivering to the enrolled members, to the subscribed members. And also, HMOs like Avon also go through an accreditation process. So they go visit a hospital and they score them on certain parameters before adding them to their network.
To their network, okay.
Bad hospitals don't get added. And if they got added when they were good and they start deteriorating, they can also get delisted.
Okay. Fantastic. So you do due diligence on the selection process for the hospitals that you were relating with your brand. And what happens in an interim? Let's just say there's a situation whereby you registered an hospital and they are good. You felt they are still good, but something happened along the line, maybe with their management, and their service quality drops. And during that period of drop, one of your clients has had to go and experience that situation. What do you do to remedy it? What do you do to remedy that problem?
Happens. What we like to remind people is that it's a partnership, and we have, you can imagine, over about 1,200, 1,500 hospitals across the country. So the best, let us know when hospitals are having issues are the enrolled members that we have who visit those hospitals. So, and we have a center that works 24/7, 365 days a year. We pride ourselves that every call to the call center gets answered and issues are resolved within the first 5 minutes. Any call to the call center will get picked, and there's somebody at the other end that is able to take action to resolve whatever the issue is. And part of the resolution is directing you to another hospital within the network that is near enough if you desire that action. If you do not want to have anything to do, we can always give you another hospital to go to that is near you.
Okay. So rather than people panic and say, the HMO has taken them to a bad hospital, it is better for them to report it as giving the HMO and the information that, look, HMO, come on, that hospital that you say you think is good, see what they did, and you guys can now fix it.
Yeah.
So it's not your fault for the hospital's services to drop. You have done your due diligence and hope they maintain their quality. But once they drop the ball, the clients should be able to report that hospital so that they either get sanctioned or delisted from your network, and you will now help the person enroll into a better facility. That's very, very good. Now, coming back to the dance industry, ma'am, based on my request, what do you think can be done? Because I'm asking for 3 things and I'm asking for plenty. So the first thing I'm asking for is, I want a HMO plan that is customized for us, because there are certain ailments, there are certain injuries, there are certain things that are particular to our own, industry that we go through a lot. We have a lot of fever and typhoid because we stress the body. So even when there's fever in the air, we catch it a little bit earlier because it might be in the situation where the body is already stressed. So we got that, and we have injuries, we have sprains, we experience sprains and all of that. So how do we customize something for the creative industry? One, that's number 1 request. Number 2 request is that I have seen different prices of HMOs across the country. How can we have a price that we can afford? Then the third one is the hardest one. How can we maintain quality even with that price?
Very good. I mean, to customize a plan for the creative industry working with you would be easy. We'll do a focus group with you and a couple of the other creatives. We'll just sit together and then just dive down, and then you will give us the information that we need to put a plan together. Because this is also an industry we want to support with your help, we are going to really, really bring the price low in order to make it affordable. And we'll work together to see who and who we can talk to that might want to throw in their support in other ways as well. I mean, we have hospitals on our network as well that might want to support whatever it is we're doing with you and the creative industry.
Wow, so that's great.
What ways they can support us across the country, And that's the first and the second. On the third one, quality is important, and we will never sacrifice that for price. So rest assured that whatever we end up working with you to deliver as a solution to the creative industry, it is going to be at the quality. I know that there's been attempts prior till now, the movie industry in particular, to get a health plan that its members would subscribe to, and it just never really worked, because people can recognize when something is not of good quality, even though it's very cheap. No matter how cheap you make it, nobody will buy it.
Yes, I've experienced a situation whereby some people have offered things that it looks, from the price point, it looks very, okay, this one is good. But by the time we start digging into the quality of service, I'm like, no, then the local swear for me, that Kathy, but you, because right now, my brand's integrity is also at stake. That if I tell dancers, this is for you, this is what you should have, people are going to believe that. And if they try it and they don't get, they don't get enough the quality, it will look like I just threw them as not, like I don't want dancers to feel like numbers to people. Yes, we have hundreds of thousands of us scattered nationwide, but what is important is once one person can say it is good, it is easy for that ripple effect of encouraging many other people to actually take up the plan. So yes,
and do, because we have to also, I like one of the people who signed on earlier and talked about, look, is there some kind of association? Is there a way we can get dancers together in mass, in mass numbers? Is there a way to bring them together in clusters? Because that is the way health management, HMO plans, health plans work. You know, it's gathering together of people and putting together what they have as funds into a pool. And it's from that pool that people then get looked after when they fall ill and when they need medical attention. So part of what we're going to be doing with you is to pull people together, pull them together into clusters, even if there's no national association as such. But in what ways can we get people to come together and be registered together in some way in which they are visible and identifiable? And then we also know that, you know, it's really not practicable to expect them to bring out sums of money in mass at the beginning.
Yes.
So you and I will sit down together with a larger focus group of creatives and really get an in-depth understanding of how your industry works and what is affordable for you. And
thank you so much. Yes, thank you so much for that, because that's one of the things I'm looking out for, because we need to grow beyond just the aesthetics of our industry. Our industry is providing food on the table, and if we treat it properly and grow it properly, it can actually, just like music and comedy has done, it can actually start in the GDP of the company, the country, the economy can be better, because there are a lot of young people on the street. If the young people are empowered, and to empower them is, first of all, let them be feeling good. Let them be feeling good in body and in their mind. Because a lot of young people are depressed, mental, like there's too much going on. Okay, look at the situation with the SARS going on. And an average young creative is the first target for SARS. They're like, there's like a target, like there's like a target mark at the back. Hello, what did you say, ma'am?
I said the creatives as well as the people in the tech industry, the coders.
In the tech, they're like targets, because we don't look like corporate Nigeria. We don't look normal. We are hoodies and punk hairstyle and red hair, and because that is what they enjoy. Even the people that are the police themselves, they don't go to the club and see cloaks. They attend, they go to bars, they go to concerts, they watch people on stage. They don't expect them to dress in suits to be on stage. So if you sit on in an environment and enjoy entertainment, the entertainer himself has a profile. So you understand that kind of thing now. So I just believe that what we are doing right now is very, very connected to eradicating the mindset that the creative industry cannot contribute to the wellness of the nation, when all the youth, most of the youth that we have, are in one creative field or the other. So we also need to protect, and I believe that what we're about to do with Avon is protecting one segment, their health. Because let's say, God forbid somebody is brutally beaten or experiences the police brutality and has an injury. We are still coming back to this health problem again, because they need to be taken to a hospital. Yeah, because I see a couple of people here saying, let's talk about SARS, let's not talk about health. And I'm like, we cannot be talking about SARS without talking about health, because most of the young people that have been, especially the ones that even died, some of them, if they have gotten emergency treatments, they probably will have been alive. And I've seen those that there's a situation whereby a guy was stabbed. He was stabbed. Do you know that this boy was running around the streets? Nobody came out to help him, because everybody's afraid that we don't know who stabbed him. Can you understand that mindset? That we don't know who stabbed him is more important than this guy is dying, let's go and help him. So our problem is Nigeria is beyond SARS. So we are even trying to educate the people that, look, a life is important. Whoever is taking it is one thing, but we all need to be protecting ourselves, because this guy now that was stabbed was a victim of an attack that was not even SARS oriented. There was no hospital to take him to. Even when there was the hospital, he didn't have the money.
And people around, let's not forget, like you say, in situations of emergency like that, people need to help, because they know when they get to a hospital, they will ask for money. So when people see neighbors, other young people on the street, they've suffered, an injury, they've been attacked, or even maybe having a fit or had a heart attack or just fell down, got injured, or maybe, even sometimes these hoodlums in the traffic have stabbed somebody or have attacked somebody with a machete or a knife or a bottle. People think if I get to the hospital, they will ask for a deposit. I want to help you, but I don't have money. And these are all the kinds of situations that when we're talking about brutality, when we're talking about everything that the youth have to deal with in Nigeria today, a health plan is one of the most crucial things you need to first sort out.
Yes.
Work for yourself. If you
Yes.
work for yourself, you need to sort your health. Remove that headache from your mind, first of all. Guarantee yourself that no matter what happens, I can preserve my health and my life.
Yes.
Without health and without life, we have nothing. So it's really amazing to me when I talk to young people and I'm trying to tell them that it's important for you, before you please set aside money to buy shoe, to buy bag, to buy the latest trainers, to buy all these other things. Can you please set aside money, a little amount, for your health? Preserve that and your life, because it's when you have it that you can use it to generate wealth and you can use it to generate a livelihood for yourself. So that is really where I want this conversation to go. I want the young people in Nigeria to set aside money for their health, the same way they set aside money for the landlords.
Is it like phone? Landlord is even an essential thing. I'm telling you that I've had cases whereby dancers, when they get their first 100K, 20K, is phone. Phone is phone is the first thing in their mind. iPhone. I'm like, So I think this is where the conversation of awareness comes into play. And I'm very happy with the kind of conversations we've had towards that. I think it's one thing to say there's a product that can work for you and whatever. It's another thing to understand that you need it, understand that it's a priority in your life. A lot of young people do not understand it. What they understand is, once I make the money, make I chop life. But we need to know that chop life, part of chop life is healthy life. Preserving the life is part of chop life. So as you're thinking of chop life gang, also think of, I need to sustain the life that I'm chopping gang. I need to keep it together. You understand what I'm saying? So we need people to know that chopping life means sustaining it as well, keeping it right, keeping it healthy. And in the terms of awareness, how big do you think we need to go in creating awareness? Like, I feel we need to go into Instagram is not enough. Instagram is not enough. Like, we need to be on the street.
We really need to be on the street. We need to tell people, because, you know, when I have this talk with young people, I'm amazed. The young mind is it's like a sponge. I tell my friends and my peers that it's not our age bait I'm interested in. I'm interested in the future of this country. You see, most of us, generation, we were raised on, it's not my portion. You use faith to deny, God forbid that I would ever have cancer. God forbid diabetes will come near me. God forbid. Not my portion, not my portion. And then, you know, you go to the GO, you go to pastor, you go to priests, you know, and then some others, they take a go. I must confess, my mother gave me a go when I was young. I'm not abusing people that take.
We too, all of us do. We all drank our.
You know, but the truth of the matter is that for a certain age group and a certain generation, we're so set in our ways. And it is showing now. There are women in their 40s who are on medication, 30s who are on medication every day for high blood pressure. There are friends I have who are in their early 40s whose arteries are already hardening. They have cardiovascular issues already. They're taking medication. So why am I saying all of this? Is that, you see, the preventive measures that we should have been taking in our early 20s, early 30s. The interventions we didn't know about because nobody told us, we went on any health plan, we're just living our lives as we knew it, have resulted in the kind of life we find ourselves living in our 50s, 60s, and beyond. So my focus is on the youth. If you're 18 and above, if you're in your early 20s, early 30s, I want to talk to you about your health. I want to ask you, what are you doing about your health right now? How are you investing in your health, in your body, to make sure that it will serve you well into your old age? To make sure that you continue to be able to optimize your body and your health to generate wealth for yourself. Are you generating wealth consistently? Have you ensured that your health is so well taken care of that you are able to consistently generate wealth for yourself without any break in transmission? Because a break in transmission will cost you, and will cost you, you're not a salary earner. For those that are salary earners, they're their health plans.
Yeah.
Almost large, medium-sized company in Nigeria now has put all their stuff on health.
Standard. It has become a standard. So the creative industry need to create a standard out of it. We need to create a standard out.
And the government is still going to make it compulsory. Anytime you employ somebody and you have up to 5 people, 10 people in your employment, you must give them a health plan. But most of Nigerian youth, we don't want to work for anybody, which is fine. But you that you are working for yourself, that you are the boss of yourself, like you are the dance boss now, you are the boss of yourself, Kathy.
Yeah, you're dance bosses.
The boss of themselves.
Yes.
Have you sorted out your health? Do you have a health plan? That's the message, and we will shout it from the rooftop with your health, Kathy.
Yes, thank you so much. Like, I don't even know what else to say. I'm so excited. I'm excited more about what this conversation will yield, because I've known you, I've studied you, I've read your profile. You are a doer. You are a doer. Yes, reading about you and seeing how much of a revolutionary person you are in any space that you find yourself in, and knowing that you are also a lawyer as well, means that you understand human rights. You understand what it is that people should have as a citizen of a nation, and the responsibility that they have, an obligation they have on themselves towards the growth of their community as well. And I am happy that you are ready to even help. You understand? Not only did you mention the fact that we know that a lot of young people might still struggle, even if we come up with a cheap health plan, we still need to, they say, lend a hand. We still need to, because me now, I've already said it at my foundation, at least 500 dancers, I'm going to look for sponsors for them. You understand? Yes, I want to look for sponsors for 500 people to say, okay, if you create a health plan today, just know that I am going to fight tooth and nail with all the people that we can't know billionaires in this country and not be able to talk to people. There are corporate organizations that love to do CSR to say, look, save a dancer's life today. Let's sponsor people, because by the time people start benefiting from it, it is easy for them to start paying for it.
Exactly.
Because they can tell their friends that, oh, I got it for free, but because you can only do free for 1 year now, you can't do free for 5 years. So even if you do free for 1 year and the person benefits from it, he knows that this thing they talk, it's not lie, next year, let me save my, and how much is this thing? If you are not trying to be over the top, you're not going to spend 100K a year.
Nope.
You're not going to spend 100K a year. Do you understand? So what are we talking about here? So we will do all we can. This is a fight that we are pushing, and I do hope you come on board. We have conversations. Even though you have not said yes, I put you there, the dance boss train, and because you said you want to be part of it, I said I'll put your logo there. So I'll put your logo there, because that is an avenue whereby we can actually welcome the awareness platform.
I idea of the Nigerian youth, we're a funny bunch. Every time one also goes to other African countries or goes to other parts of the world, and I'm sure you've had this experience, Kathy.
Yeah,
there's something about Nigerians. The passion, the energy, the single-mindedness for excellence, the ability to thrive in spite of any situation, and the ability to rise above and always find that the top 25, 10% of any industry, you will find Nigerians in that top 5%.
yes.
The cream of the top, we're always Nigerians. So this youth, Kathy, are for great things. But I know society sometimes presses our youth down. I know that many things mitigate against the ability of the average Nigerian youth to fulfill their potential.
Yes.
But one of the I want to take away is the burden of not having access to good quality healthcare. Let's do that.
Thank you. Thank you for doing that. Trust me, I'm a soldier for this cause.
We will take away the burden of ability to access healthcare, because even if they get brutalized by SARS or other people, when they have a health plan, they will get access to medical care.
Amen. Amen. Thank you very much. Because like I said, saving the life is very important, because SARS is not the only thing attacking us. So we have SARS attacking us. We have ourselves attacking ourselves. We have uncertainties of life. You can walk on the road, and I have a dancer that broke her femur. Her 2 femur bones broke, and she's a dancer. Yes, she had to go through years of rehab. And if there was enough money and health plan, it would have cut that time by half. So they had to, you understand? She had to get back up her feet again. So there are many things that could affect our well-being beyond the vices in the society. And thank you very much for this. I am ready to go all the way with you. And I know that the dancers that are here right now are listening to this, the creatives that are listening to this, know that something is being done. What we just urge you all to do is when we start this movement, support it in your own way. We don't even need to support it with money. We are saying tweet about it, talk about it, spread the word round so that your brother, your sister, your uncle, and auntie's life can be at ease when they have the access to healthcare plan. Thank you so much, Mama. Thank you so much for being on. But I'm looking forward to the next. I'm looking forward to the next step.
Thank you.
Thank you, ma. God bless you, ma.
Bless you too. Bye. Bye-bye, everyone.
Bye. Okay, guys, there you have it. There you have it. Thank you for all of you that tuned in. You understand? Like I said, this is not one of those programs that we are seeing naked girls and all of that. So those of you that are saying, only 54 people viewing, don't worry yourself. If we save 54 lives, it's better than no life at all, my brother. Okay, and 54, let us see, the Bible says 1 shall chase 1,000. 2 shall chase 10,000. So if it's only 50 of you here, do you know how many you can do? As Damilola said, the catch and drive for this program is the suspense of what to expect from a conversation and a collabo between the duo influencer. Thank you, Cafe Dance, for championing this. Staying alive. Thank you very much. Staying alive, exactly. We want to stay alive. Staying alive is most important. No matter what we achieve in this world, if we are not alive, we are not going to enjoy it. So thank you all for tuning in. Watch out. This Sunday also, explosive things are happening. I don't talk alone. I did do. On Sunday, 6 p.m., don't miss it on this page. I have major announcements and major things about to kick off in the industry. We are moving forward. Dancers' lives matters. Choreography, creative lives matters. God bless you all. Thank you.